Hello everyone. So the next topic which we will be discussing here is about the autoimmune diseases. So what is an autoimmune disease? What are the various types of diseases? So we will be discussing all of these in detail now. Now starting with the introduction first. That what is an autoimmune disease? So an autoimmune disease, it is a condition in which your immune system mistakenly attacks your body. So the cell, the cells of your immune system will start destroying its own body cells. So in an immune system, what is happening? The immune system mistakes part of your body like your joint, skin or other foreign things and starts attacking them, and it releases proteins which is called as autoantibodies that will attack the healthy cells. So normally what is happening is the immune system guards against germs like bacteria and viruses, and when it senses these foreign invaders, it sends out an army of fighter cells to attack them. So normally the immune system can tell you the difference between the foreign cells and your own body cells. But in case of an autoimmune disease, the immune system mistakenly mistakes part of your body like your joints, your skin as foreign, and it releases proteins which is called as autoantibodies and attack the healthy cells. So these are some of the main reasons which can be the cause of autoimmune diseases. For example, it leads to the genetic hereditary also. So if there are previous generations which are being affected by autoimmune diseases, then the other generations are also affected. So the genes can be a main reason for autoimmune diseases. Then immune regulation is one of the factor of the autoimmune disease, and environment also plays a major role in the autoimmune diseases. So what are the symptoms of autoimmune diseases? So the main symptoms of autoimmune disease include the fatigue, joint pain, swelling, skin problem, abdominal pain, digestive issues, recurring fever, and swollen glands. So these are some of the symptoms of the autoimmune diseases. Now, what are the various risk factors that can cause the autoimmune diseases? So in the first slide itself, there was a diagram which is showing that what are the risk factors that can be the cause of the autoimmune diseases. So the risk factors includes the genetics. Genetics, which means there are certain disorders, for example, multiple sclerosis, which tend to run in the families. So having a relative with autoimmune disorder or disease increases your risk, but it doesn't mean that you will develop a disease for certain. They are at risk, but it will not be guaranteed that you will develop a disease from this. So genetics, it plays a major role in the autoimmune diseases. Weight is also one of the risk factor. So for example, being obese or being overweight, it raises your risk for arthritis. This could be because more weight puts greater stress on the joints, or because the fat tissues make substances that encourage the inflammation. So weight is the next risk factor. There are certain medications also. For example, there are certain blood pressure medications or antibiotics that can trigger drug-induced lupus, which is often a more benign form of lupus. So it is one of the reasons. So myopathy, it is a rare autoimmune disorder that causes the muscle weakness. So before starting or stopping any medication, make sure you talk to your doctor first. Okay. The next is the smoking. So smoking, the research has linked smoking to a number of autoimmune diseases, which will include the arthritis, hyperthyroidism, and multiple sclerosis. So these are some of the major risk factors of the autoimmune diseases. Now, the first disease that comes is the type 1 diabetes. So the type 1 diabetes, it is an autoimmune disorder or disease. So what is happening in this is the pancreas, they produce the hormone which is called as the insulin. So what is the role of insulin here? The role of insulin is that it will regulate the blood sugar levels. In type 1 diabetes, the immune system attacks and destroys the insulin producing cells in the pancreas. So this is a chronic disease. So in people with type 1 diabetes, cells in the pancreas that make insulin, they are destroyed and the body is unable to make the insulin. So there, if the insulin, what is insulin? Insulin is basically a hormone that helps your body cells to use glucose for the energy. And when your body gets the glucose from the food you eat, insulin allows the glucose to pass from your blood into your body cells to give you the energy. So when there is a high blood sugar results, it can lead to damage in the blood vessels as well as the organs like the kidney, eyes, heart and nerves. So it will lead to the damage of these things. Now what are the various symptoms of this disease? So the symptoms include the excessive hunger, excessive thirst, blurred vision, fatigue, frequent urination, and then when there is a dramatic loss in a short period of time. So this is what is the symptoms of this type 1 diabetes. Now the weight loss, frequent urination, irritability, blurry vision. So these are all the signs and symptoms of this. So everything, every detail is being given just below the signs and symptoms of the type 1 diabetes. For example, weight loss. This can affect some people with type 1 diabetes and could be a warning sign if you have not changed your diet or exercise routine. Frequent urination, this constant urge to urinate, even if you recently, if you, even you have recently. So this is very uncomfortable. Irritability. So there are some cases of type 1 diabetes which may cause confusion and anxiety and makes you testy. Blurred vision. So there is a blurred vision. This is the sign that your diabetes isn't under control. So when the blood sugar levels are high for a longer period of time, water is pulled into the lens and causing it to swell. So you will have a blurred vision. Fruity breath. If your breath smells similarly to acetone, it may be signs of high levels of ketones in your blood. So these are all the signs and symptoms of the type 1 diabetes. Next disease comes is the arthritis. So in this, the immune system attacks the joints. So this attack will cause the redness, warmth, soreness, and stiffness in the joints. So unlike the osteoarthritis, which commonly affects the people as they get older, rheumatoid arthritis can start as early as about 30 years or sooner. So here is a diagrammatic representation which is showing the healthy joint and the arthritis joint. So in the healthy joint, you can see there is a cartilage uh, which is working properly, and this looks fine with it. But in case of rhythmatic arthritis, what is happening? There is a bone which has been eroded. So you can see that there is a swollen, inflamed membrane. The cartilage, you can see it is a cartilage wears away, and there is a very reduced space in the joints. So you can compare the healthy joint and the rhythmatic arthritis joint, that this attack causes redness, warmth, and stiffness in the joints. So the common symptoms of this includes the joint pain, joint swelling, joint stiffness, and loss of joint function and deformities. So this can vary from the mild to the severe. It's important not to ignore your symptoms even if they come and go. So this is what is the rhythmatic arthritis. Next is the next type of arthritis. So what is this is, you can see in this particular figure. So these arthritis and processes in which the cells grow and then shed when they are no longer needed. So they go and they shed when they are no longer needed. This particular condition causes skin to multiply too quickly. So the extra cells which are built up and form inflamed red patches, commonly with silver white scales of the plaque on the skin. And up to 30% of the people with cirrhosis process, they also develop swelling, stiffness, and pain in the joint. So this is the form of the disease. So you can see in the particular figures that what is the condition of the skin and what is the condition of the joints in both the cases. Next is about the multiple sclerosis. So multiple sclerosis, so this is a healthy neuron. You can see there is a healthy neuron which is there, and this is a damaged neuron. So in damaged neuron, the there is, so you can see the man is holding the cup very properly in the healthy neuron, but in damaged neuron the person's hand is continuously shaking because of this. So multiple sclerosis basically leads to the symptoms like numbness, weakness, balance issues, and trouble in the walking. So multiple sclerosis, it damages the mycelium shield, which is the protective coating that surrounds the nerve cell in your nervous system. Damage to the mycelium shield slows the transmission speed of messages between your brain and the spinal cord and from the rest of your body. So this is the case of the multiple sclerosis. It is also a chronic condition which is involving your central nervous system. So your immune system attacks the mycelium, which is the protective uh, layer around the nerve fibers. So multiple sclerosis causes inflammation and temporary lesions. So it can also lead to lasting lesions caused by scar tissue, which can make it hard for your brain to send the signals to the rest of your body. So as such, there is no cure for multiple sclerosis, but it's possible to manage your symptoms. The next disease comes is the celiac disease. So celiac disease, it is the disease in the people with this disease, they can't eat food that contains the gluten, which is a protein which is being found in the wheat, rye, and other grain products. So when the gluten is in the small intestine, the immune system attacks this part of the gastrointestinal tract and causes the inflammation. And the symptoms of this disease includes the headache, fatigue, abdominal pain, bloating after consuming the products with gluten. There is a weight loss, diarrhea, constipation, and foul smelling stools. So these are some of the conditions which can lead to the celiac disease. So these are some of the references. This was all about the autoimmune diseases and its disorders and the various examples that includes. So this was all about it. Thank you.